Our next presenter is going to present about Beyond the Womb, integrating psychosocial support into obstetric ultrasound scan workflows in Zimbabwe's public healthcare system. She's a nurse midwife, fertility nurse specialist, reproductive medicine PGT, Cambridge IVF clinic, global health nurse. May you please help me to welcome Ms. Sinotenda MANYERE.
This is going to be very difficult, I know. My friend yesterday warned me and she said, with the way that you were asking questions, I bet you when you present yours, everyone will be opening their ears. So like they say, like you said, my name is Sinotenda MANYERE, and my presentation will be biased more on infertility. You will hear the word infertility more than any other word. Are you happy to do the slides for me? So this is the title of my presentation. It's Beyond the Womb. Integrating psychosocial support into obstetric ultrasound workflows in Zimbabwe's public healthcare system. And this is specifically from Mugabe Central Hospital. I'm the author of this presentation. Next slide. You can play that one. I just want to show you who I am. This is when I was in Kenya. This is when I got one of my awards. Like I said, I'm a global health nurse. This is an award from Cambridge University Hospital, another award for me. This is me. Thank you. The next slide. So, my opening book. When the sonographer went quiet, I knew something was wrong. This is a real voice that captures an emotional weight of infertility and ultrasound encounters. Next slide. So, the background of my presentation now. While advancement in fetal medicine and obstetric ultrasound have improved the diagnostic precision, the impact of infertility remains largely overlooked in Zimbabwe's public healthcare system. In a culture where fertility defines identity and marital value, infertility leads to emotional trauma, stigma, and gender-based violence at times. These stressors often emerge during or after an obstetric imaging, yet current workflows lack the integration of emotional support. The next one. So the global and local context of it all, like I said, I'm biased with infertility. It affects about 17.5% of adults globally, according to World Health Organization 2023, and Zimbabwe cannot be spared. The absence of psychosocial support deepens the trauma. So, when I was doing this short abstract, I used both methods, mixed methods, qualitative and quantitative. So the quantitative data was collected from 264 women within the age range of 18 to 49 using the DASH-21. This is a tool called Depression, Anxiety, and Stress Scale. 15 in-depth interviews were conducted via a stratified purposive sampling to capture the experience across age, marital status, and ultrasound exposure. Informed consent was obtained. So, moderate depression affected 35% of the participants. 25% reported severe emotional distress. 40% experienced stigma, and 45% disclosed infertility-related gender-based violence. Qualitative themes highlighted distress triggered by ultrasound procedures, especially during ambiguous or negative diagnoses. Patients described sonographers as technically competent, but constrained by time and lacking psychosocial training. This absence of empathetic communication and counseling left many feeling isolated and traumatized. What do I recommend now? I would recommend the embedding of mental health screening into routine ultrasound appointments. Then training of sonographers and staff in trauma-informed communication, development of peer support counseling groups and peer support groups and counseling referral pathways, then education of communities to reduce stigma and encourage help seeking. The implementation plan. The phase 1 will be to develop training modules for sonographers. The second phase will be to develop pilot mental health screening tools in antenatal clinics. The third phase will be establishing support networks and referral systems, Then the fourth one will be scaling up program across the Zimbabwean public hospitals. The expected impact: improvement of maternal health, maternal mental health outcomes, reduction of stigma and increased community dialogue, better patient experience during ultrasound, then a model for other low-resource healthcare systems. My conclusion. Infertility is a psychosocial crisis that intersects directly with obstetric care. To humanize ultrasound workflows and improve maternal outcomes, Zimbabwe's public hospitals must integrate basic mental health screening, counseling referrals, and sonographer training in trauma-informed communication. Then embedding psychosocial support into antenatal imaging is essential for delivering equitable and passionate reproductive health care. Next slide. These are my keywords. Can I have my diagram? This is just the summary of everything that I was talking about. If you have got time, you can go through it, because if I start reading it, I'll be repeating what I have just said. So this is my reference list. Thank you. So just some few minutes. May I take this opportunity to let you know that at Salemugabe, we initiated a fertility clinic in December 2024. This is a public one for that one person who doesn't have money to go to the private sector. We are not using much. We are just using ovulation tracking and ovulation induction. So from December 2024 to date, we have more than 25 pregnancies. Metro-local is here. So this is where my abstract is coming from.